and your Google Home. Back in the studio with us this morning, Drew Dostal. Good morning, Drew. How you doing?
Good morning, Chris. Great. How about yourself?
Absolutely. Doing all right. President of Corewell Health, Ludington and Gerber. And are you doing a lot of traveling back and forth between the two locations? You cover both locations, so you get a chance to visit the hospitals. But Corewell is a little bit larger than Gerber, right? Ludington.
Ludington's a little larger. Yeah. It's got about 20 more beds.
Okay, all right, and one of these days we'll have to maybe try to do a segment from Gerber if it's possible.
Oh, that'd be fantastic. Absolutely, it's possible.
Let's speaking of locations and sizes and such. There's always expansion that happens in the Corewell Health family, and this segment is no different. We're talking about the urology department this morning, and you have a guest with you here in the studio, Angela Hurd. Angela, good morning to you, and thanks for coming in.
Good morning, and thank you for having me today.
Absolutely. Angela, a nurse practitioner, and Drew, you get a chance to talk about her for a few minutes and tell us a little bit about Angela.
Yeah, great. Well, Angela's been with Corewell Health for quite some time now, 7 years, I believe, and she's done various jobs inside of the hospital. But she ended up in urology, and she took a real interest into that as she was finishing her nurse practitioner program. And she's a West Shore graduate, so she got her nursing degree there, like I did, like many of our nurses did. So really nice to have people with that kind of connection to the community who want to stay here and provide good care for long into the future. And we're really focused on that exceptional piece of what we love to do. And Angela's one of those folks, I think, that's going to help propel us to that and give us access. So glad to introduce Angela as one of our team members and or reintroduce her in many ways because people know her.
And Angela, we're going to put you on the hot seat in a little bit. But we were talking before we went on the air that, as Drew had mentioned, you went to West Shore Community College, grew up here in the area, but also have family members and friends that are part of the healthcare system, and that is part of the fabric of our community, right?
Absolutely.
And we look forward to chatting about that. We look forward to the urology department. You get to work with Dr. Reiser at Corewell Health. But Drew, let's talk about the urology department, if you don't mind, for a moment there, and the expansion side of things. What is that all about at Corewell Health?
Well, really, the expansion, when we talk about it, people think physically usually, but it's not so much a physical space that we're expanding. It's more of a footprint.
Okay.
What Angela will bring to the practice, and she can actually talk more in depth about what she will see, but she'll be able to see a certain subset of patients, whether it's for follow-ups and sometimes for initial visits when Dr. Reiser's in surgery or been called to an emergency or whatever the case may be. And eventually we have plans to expand her out of this community and maybe down into the Fremont community where they have no access for urology. They have to come up here. So we're trying to bring healthcare to people as much as we can. Even that's harder and harder nowadays where everyone's so spread thin. But Angela's going to be a real important piece for that.
All right. Well, Angela, let's do it. You ready for this conversation?
I sure am.
All right. Sounds good. Well, in all seriousness, though, the idea that people want to be able to stay local as much as possible, to not have to travel, especially if you're in pain or any sort of suffering that's happening. I don't want to jump on the road and be like, hey, I've got to go to Grand Rapids or Muskegon, it's only 45 minutes to an hour, but still we're in a stress point at that point, and we want to be able to see somebody local.
So yeah, you're absolutely right. Coming from a small town, I actually grew up, more up north in Calava. So I understand what it is not to have access to care. And I feel like we're pretty fortunate here in Ludington to actually have the access that we have. And to be able to expand that access is amazing for these patients that, they're elderly, they're not able to maybe drive themselves. They're not able to get to Grand Rapids to get the care that they need from a urological perspective. So, being able to expand services not only here in Ludington, but eventually, possibly in Fremont, that's great that, these patients, especially from Fremont area, they're in the same boat. They're driving quite a distance to get urological services. So if we can expand that care in that area, it's going to greatly benefit these patients that, may not be able to travel or can't due to, their health issues. So.
And there's literally a physical part of Corewell Health right here in Ludington, I think on the second floor, right?
Yes.
That patients. Now, when you talk about urology, is that something where, as the public, if you have that health concern, you're walking into the office, or is it referred to, referrals? How does that work?
So we take a wide variety of insurances. So, we always suggest maybe checking with if you have a primary provider, checking with them. But if you don't, you can call the office and, ask, hey, do I need a referral to get in? And a lot of times insurances now are not requiring referrals. So we're getting patients that are calling us and making appointments right off the street and saying, hey, I'm having this issue. I need to be seen. This is a big deal for me. And a lot of times we're getting patients in quicker because, with me being available to the patients in the office, they're getting seen pretty much right away, just because of that expansion, of access to care. So it's really good, that patients are able to be seen a little bit quicker just because I'm available. And also that, patients are calling us and getting in. But yeah, if patients have questions, they're more than welcome to call the office. Our number is 231-843-3717. Our girls are great. They can answer questions pretty readily. And if they're not able to, they'll find somebody that can answer the questions for the patients as well.
It's good to hear about that. When we talk urology, what are we talking about? What because I'm a little bit cloudy when it comes to this, of course, but for those listeners and viewers out there, what are they coming to you for, and how can you help them?
Okay, so urology is kind of a vast array of different diagnoses. We treat a lot of different diagnoses within the urological system. In adult patients, male and female, we do treatment for BPH or enlarged prostate, elevated PSAs, incontinence issues, overactive bladder. We're also treating kidney stones. The list goes on. So anything within the urinary tract, if it pertains to urology, a lot of times we're seeing these patients for that. And if we can't treat it within the, Ludington area, we also have a great group down in Grand Rapids that we can send these patients to that can do a little bit more if need be.
All right. I might put you on the spot here in a moment, because we always talk, Drew, about how to keep people out of the hospital, right? And so, Angela, I might ask you a question here in a moment about, health-wise, what we can do to avoid coming to see you, if that's okay, if that's all right. But Drew, that is a big part of Corewell Health's mission is to try to eliminate people that have to walk through the door and for those reasons, but still be there for them.
Yeah, part of the population for all of healthcare, but particularly at Corewell, we focus on population health. And with that is really keeping people at the maximum level of wellness that they can achieve so that they don't get into a crisis mode and have to come into the emergency room where care is really expensive. We recognize that. Our gross domestic product is almost a quarter of what we spend in the United States on healthcare. And that is just not acceptable. So we're trying to keep people out of there. And there are many ways that there's wellness around every single specialty. So it's really important. That's why I love these segments, because we have an opportunity to talk about people don't think about urology all the time, but there are wellness things you can do for that. And that's where Angela and Dr. Reiser come in, and they can really supply people with a lot of good information.
Absolutely. And Angela, that list, just to expand upon it, you'd mentioned the enlarged prostate, elevated PSA, but any sort of kidney stones, which I went through, people might have remembered my surgery. Did I see Dr. Reiser? Was he okay, he was the doctor. Which on the follow-up, I only remember like the first few minutes, and you only remember that prior to pre-surgery. But he had this cape, the gown on, right? And it was very colorful. And I'm like, I feel like a kid because it was very colorful in the sense. But recovered pretty quickly from it. So thanks to your team there for doing that.
Well, I'm glad you're doing well.
Absolutely, I'm standing up straight. And, but from the blood in the urine, urinary-related cancers, as well as is it hydrocele?
Hydrocele.
Oh, hydrocele. There you go. When we look at all that list that lands in your department, going back to that original question that I was thinking about, what can we do as a community to try to prevent people from coming to see you? Is it food related? Is it exercise? Is it all of it? Is it particular things to stay away from? Here's an opportunity for you to give us a couple of tips, if you don't mind.
Well, I don't want to offer medical advice over the air, but I would suggest keeping your body as healthy as possible. And, it's funny that you say that because Dr. Reiser always says, keep your heart healthy. That's the biggest thing. As long as your heart's healthy, you're staying well hydrated, hopefully you won't be seeing us anytime soon. But that's the biggest takeaway is keep your heart healthy. All
right. Good to know that. If you're just joining us, we're talking with Drew Dostal, president of Corewell Health, the Ludington and Gerber, as well as Angela Hurd, a nurse practitioner in the urology department there. Let's talk about Dr. Reiser. He's not in the studio. Can we talk a little bit about him? Is that okay?
Yeah.
All right. Let's chat about him as a physician. How would you, if you work with him obviously on a daily basis, how do you describe him?
He's just a, down to earth, very friendly, very approachable person. Patients often make comments how friendly he is, how approachable he is. They don't feel intimidated when they meet him. He's very, comes into the rooms like he's already known these people. They can sit down and have a decent conversation with him and not feel like he's talking over their head. So, I think patients feel very welcome by his presence and reassured. He's very knowledgeable. The depth of knowledge that he has is just amazing. And, I'm constantly trying to soak things up from him because he's just so, his depth of knowledge is just so vast. So I think patients feel reassured by that they're in good hands, but also feel like, he's a friend to them, that he's invested in their health just as well as they are. All
right. And hopefully he's going to listen to this or watch this and be like, hey, you earned some brownie points.
I tell him all the time.
That's good. Absolutely. Testing procedures, when somebody does visit your office and does work with Dr. Reiser or any of the staff members, what is that experience like? What are some of the tests that might be performed at the office there?
So we actually offer a few different diagnostic procedures within the office walls. We offer urodynamic testing, and I actually perform that in the office. And that's just testing the functionality of the bladder. So if a patient comes in, say with urinary retention, and we can't, we've tried to treat them and we've looked in their bladder and there's some suggestion that maybe their bladder is, overworking. Sometimes we need to perform urodynamic testing just to see if their bladder's squeezing like it's supposed to, that it's holding the urine like it's supposed to, and it's able to squeeze and get the urine out of the bladder like it's supposed to. Because God forbid we do a surgery on a patient that, say a TURP, where we're opening up the prostate, and the patient's not able to, their bladder's not squeezing like it should anymore. So we're creating more issues. So we want to make sure that bladder's working. So that's urodynamic testing kind of in a nutshell.
Okay.
And then we also offer cystoscopy in the office, where we can take a look inside the bladder and evaluate the inside of the bladder and make sure there's nothing anatomical within the bladder that is wrong that could be causing symptoms for a patient. We're also looking for cancers, especially when we see hematuria or blood in the urine. We do a cystoscopy to determine, is there a tumor within that bladder? Is there a stone? Is there an ulcer or anything, like I said, anatomical that could be causing symptoms for that patient?
And a lot of times this is not well, a lot of times this is very different than what it would have been 5 years ago, 10 years ago, because
Exactly.
you're using a lot of these micro cameras, right?
Yep.
These small cameras to diagnose that.
Yep. So the cystoscopy, actually, recently we actually went from, the old school lighted telescope where he had to actually look through the lens with his own eye to actual screen so that he can look up on a screen and see where, what the telescope is seeing.
Okay.
So like I said, it's a little lighted telescope inserted through the urethra. It's a pretty straightforward procedure, but it tells us a lot of information about the urethra, the bladder, and even the prostate.
Mm-hmm. What about when it comes to ages and people in general? Are you seeing this, and is this topic really focused for more of that older demographic, or you're shaking your head already? So then tell me a little bit more about that, if you don't mind.
So younger folks too need to be. I don't think we were. I can even attest to this. We weren't educated about our urological needs growing up. We don't hydrate enough. And, the biggest reason why people produce kidney stones is because they're dehydrated and they're eating too many processed foods, too much salt, essentially. So I think it's important that younger generations are educated on different urological conditions as well, because it does affect a lot of our body. I mean, our whole body is affected by our urological health, because it affects our kidneys, it can affect our blood pressure, it can affect our whole body. So it's important that the younger generation understand that we need to take care of our urological system. We need to take care of our kidneys and our bladder, just to feel better throughout our life.
And hopefully segments like this help contribute to that. But do you see that we do have that education out there, or we're starting to move that direction a little bit?
I think it's getting better. You see commercials on the TV about different medications. So then we get patients coming in asking about these medications. So it does spark a little curiosity when they're seeing commercials for these meds. But I think there needs to be more education incorporated. And, even like high school, if they're having a health class, they need to focus more on, interventions kids can do early on to prevent future problems.
Absolutely. We're talking with Angela Hurd, nurse practitioner in the urology department, Andrew Dostal, president, Corewell Health, Ludington, and Gerber. You're listening to Angela over the last few minutes. Anything that you want to contribute in regards to some of the topics that she's talked about, if you don't mind?
I don't know that I could contribute. She does so much more than I would ever try to step into. It's amazing what they really can do in the office, and they do in the office for people, for convenience. Okay. So you don't have to go to the operating room and incur expense and see Dr. Reiser in his X-ray gown.
Yeah, that's right.
But it's amazing that we can do that, and I'm totally appreciative of the fact that now with Angela joining the team in the capacity that she's doing, we can divide and conquer, as it were, with Dr. Reiser's time, so that she can do some of the work that was limiting what he could see in the office, because he was just one person, and now there's essentially two, which is really nice.
And Angela, we appreciate you being there, because I think just as Drew mentions that, first thing that comes to mind is wait times to get in, and sometimes from a healthcare standpoint, we just think about it. It's like, oh, it's going to take months for us to get there, or weeks, or whatever it is. And a lot of times, one, we don't have that time. Two, there is the inconvenience, or the as we talked about earlier, the pains, the symptoms that come along with it. That's where you come in, and so I guess my question is, because of you being part of the team, has that reduced that wait time? Have you noticed it? Has the team there in the urology department noticed it?
So yeah, absolutely. I think patients are being seen a little bit quicker, and it is freeing up spots for Dr. Reiser, who is our surgeon. So if there is a case that needs to be evaluated quicker, he's able to see those patients and get them in as quickly as possible, and for treatment. So it is a good thing that we have a little bit more availability.
All right. Before we wrap up this morning, we've talked a lot about this, but people can read more on Corewell Health's website about the urology department. But in your own words, what's your message to the community this morning to be able to know, one, that you're there for them, but two, so that it makes your job just a little bit easier, that and it's not necessarily self-diagnosing all the time, because it's tough to do that, and sometimes we have to react to that pain that happens, or that. But anything that we can do as a community to help you and Dr. Reiser and the team a little bit.
I would just say, to people, just take care of yourself. Try to stay as healthy as possible. And don't wait. If you do have a concern and you're having symptoms, either go to your primary care provider, and they'll, refer you on to us, or, give us a call and set up an appointment. We can sit down with you and discuss what's going on. Don't wait until it's so frustrating and that you're having so many issues that, we get you in there and we end up having to do so much more for you than if you would have come in a little bit sooner. Maybe we could have intervened a little bit sooner. So that would be my one advice. Just don't wait. If you are having symptoms that are bothersome, incontinence or overactive bladder symptoms, or anything along those lines, just give a call, get an appointment, and sit down with us, and we can try to create a plan for these people before it gets too severe.
All right, good plan there. And the phone number 231-843-3717. We'll post that in the comment section on our Facebook page, and just keeping connected, I think, is important. Drew, as we wrap up this morning, last words from you. Any sort of message that we want to share with the community?
Nothing new brewing that we need to share too much. Made it through another summer with the rest of the community's help. It's been an amazing summer, and I think that we're going to continue on. You'll see the crane there for a while longer at the hospital, and every day it seems like something new gets done. Pretty soon we'll actually be closing another section of the second floor, and opening the new section, so people will begin to see what it's going to look like. So in the next few weeks. So we're looking forward to that.
And that's part of that conversation. If you drive by Corewell Health in Ludington, all of the storage containers there,
yeah, exactly.
That's the construction happening there. And when do you foresee everything being wrapped up in this particular phase? Are we a year or two out, do you think?
So the cancer center is going to be, we're planning on having people in there working, ready to go in January. Okay. And then as far as the second floor, having that completely done is not going to be until 2025 in spring. So it takes some time, but we do it in segments. So the segment we're doing now, we're hopefully going to be done with that in January as well.
All right, sounds good. And the one thing, I know that's kind of off the cuff, but whoever is maintaining the lawn there at the hospital, I need to hire them, because you have one of the best lawns here in the community. It's incredible.
Well, one of the changes I made when I came back was to get Larson's back.
Okay.
They had been doing it when I was here before, and they came back, and they've been helping us since. So there you go. Larson's, I plugged you. There you go.
Absolutely. I'll be calling them later today, because I keep driving by there, and it's amazing. Well, we appreciate the two of you coming in. Drew Dostal, President, Corewell Health, Ludington, and Gerber, and as well, Angela Hurd. Thank you, a nurse practitioner in the urology department, working with Dr. Reiser. We appreciate all the team there. So thank you for coming in.
And thank you for having me today.
Absolutely. Stand by if you don't mind. It is 8:56 now, before the top of the hour, here on 102.7 WMOM and Hot Country Hits 99.9. If you missed any of this segment, you can watch it in its entirety on our Facebook page and our YouTube channel, so check it out there. It is 102.7 Mom FM and Hot Country Hits 99.9.